I should always think about ATTR-CM with heart failure preserved ejection fraction because they present the same way. Early on in the diagnosis, it's the exact same patient. And if you're not thinking about amyloid, then you're going to miss it. And we do this rotation on service where I'll help lead a resident team once a year for two sections of 2 weeks each. And all but one time I've been on firm service, I've diagnosed a new amyloid patient. But that's because I'm thinking about it. That's not because the amyloid patients only present while I happen to be in the hospital. And so if I see a patient with HFpEF or even HFrEF, even reduced rejection fraction, I'm going to think about it. I'm going to look at that echo. I'm going to see if it's thickened or not, and look for maybe some other characteristics. I certainly would expect in amyloid patients that the strain is lower than normal. So a normal strain might reduce my chance of looking. But for the most part, it's a non-invasive workup. It's very easy to do a PYP scan, rule out AL amyloid, and potentially rule out the diagnosis. But if I do rule it in, if I find it early, then that helps me trigger treatment and help the patient out for the long term.
Indication and important safety information. Indication: Attruby, acoramidis, is indicated for the treatment of cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular death and cardiovascular-related hospitalization. Important safety information. Adverse reactions: diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.